Thank you for coming. My name is Steve Tashiro, Dr. Steve, and I'll be sharing this next period of time with you, sharing some important information about female hormone imbalances. I've worked in healthcare now for 40 years, and I initially graduated with a master's in nutrition from the University of Bridgeport in Connecticut. And I worked for quite a few years helping people with chronic health conditions from a nutritional point of view. I graduated from chiropractic school in 1998, and now I incorporate what I learned through that training, plus in many postgraduate courses, in a method of treatment described as neurometabolic care. So tonight, when we talk about female hormone imbalances, we'll talk a bit about the role of the brain, because hormone balance is contributed to by the health of the brain, especially a part of the brain called the hypothalamus. In a holistic approach to health, we realize that every part of the body works together in support of all the other parts. And one of the big errors, I believe, in contemporary healthcare is the fragmentation of the view. There's many specialties now in healthcare, and very often in taking an in-depth look at a specific part of the body, for example, the endocrine system, the holistic view is lost. And so that's one of the key concepts that I hope to impart to you tonight, the importance of an overall view of the body, even when we're considering female hormone imbalances. So I want to talk you through the handouts, because we'll be referring to these quite a bit as we go through the evening. We do a lot of talks on different conditions, and if you'd like us to inform you of future talks, just fill out this blue communication form and leave it with Lisa or Jennifer at the front desk before you leave. There's a page that has patient success stories on it, included in your packet. Now, all of these women came into our office because of symptoms that related to hormone imbalances. They didn't always know that that was their problem, and so when they wrote these stories, while some of them do talk about hormone imbalances, most of them don't, but essentially that's what we helped them with, leading to the improvement that they describe in their health. The next page we included because it is a listing of the many symptoms of female hormone imbalances. Now understand that there are different types of female hormone imbalances. This describes symptoms coming from many of those types of imbalances. And as we go through the evening, we'll break it down into what symptoms relate to low estrogen or high estrogen, etc. Next page, this is very important. This is a way of illustrating the concept of holism. This is a diagram showing the pathway by which steroid hormones are synthesized or produced in the body. I want to call your attention to the highlighted hormone in the middle. It's progesterone. It's right there in the very middle of the diagram. There's an arrow going down from progesterone to androstenedione. And then from androstenedione, another arrow goes to testosterone. And then from testosterone, the arrow goes down to estradiol, which is one of the female hormones. And from androstenedione down to estrone, which is another female hormone. The line from progesterone not only goes down to androstenedione, it also goes over to cortisol. This is very important because it illustrates a key concept here, and that is that above all, our bodies want to survive, and survival is the number one priority for all of our bodies. And if there's a choice between survival and reproduction, our bodies will elect survival. Now the cortisol, which that arrow points to, is a key hormone that allows us to survive. That's a stress hormone. So if we're experiencing stress, whether it's an emergency or the day-to-day stress in our lives that keeps the cortisol level elevated over a long period of time, the effect that has is progesterone gets preferentially shunted to cortisol, away from androstenedione and away from the sex hormones. So this is one small illustration of how, again, we can't just look at sex hormones, female hormones. We have to look broadly and look at what affects those sex hormones. One of the key players determining female hormone health is stress, how much you have in your life and how well you're managing it, and what steps you're taking in order to better manage it. The next page is a graphical illustration of the fluctuations in estradiol and progesterone as you progress through the monthly cycle. We'll be referring back to this quite a bit. The next page is a report from a 24-hour urine hormone test. Now, this is the type of evaluation that I use in my office, and I'll talk about why I use this rather than serum, rather than saliva. We'll go into detail about why this is such a valuable resource for understanding a person's hormone picture. Next page, very important page. This shows the molecular structure difference between progesterone and synthetic progesterone named progestin. Synthetic progesterone is made from testosterone. So as you can see, the molecule on the right is labeled nortestosterone. Another way of labeling that would be progestin, T-I-N. That means it's a synthetic form of progesterone. Now notice the two structures. Can you see how they're different? They're not the same thing. This is a very, very important point. A lot of people who prescribe hormone replacement therapy don't understand this point. So there's a big difference between natural progesterone, like your body makes, or like is made from plant sources like yam. There's a big difference between that progesterone and synthetically developed progestin from a laboratory. It's a synthetic form that's associated with many health risks and health complications. We'll talk later about the concern that's rightly out there in women about taking synthetic hormone replacement therapy and how that's very different from bioidentical hormone replacement therapy. At the very end of the evening, I'll be making what we call an offer, and that's a chance to come into our office to receive my help in unraveling your hormone picture. We make that offer at a greatly discounted rate because by then you will have sat through this information and you'll be an educated patient. The topic of hormone imbalance is pretty complex, and it's complex because hormone patterns are the end product of everything else that's happening physiologically in your body. Hormone balance is what we call a downstream phenomenon. And therefore, to understand hormones, we have to understand everything that happens physiologically in your body upstream from that. But I want to step back before going into the detail and take an overview. One of the shortcomings in conventional healthcare is that the view tends to be so specialized that we lose sight of the big picture. So this is big picture, high level. This triangle represents what we call the triangle of health, and it's one way of representing the makeup of a human being. So on one side, we have structure and neurology. Structure refers to the spine, your joints, muscles, tendons, ligaments. Neurology is your brain, spinal cord, and the spinal nerves. We also have physiology, and this refers to organs in the body, body chemistry, everything inside our bodies that squishes when we put pressure on it. A very important part of this is what we call toxicology. And toxicology is a study of toxicity from the environment and how it impacts human health. This is a huge player relative to health, but it's especially important relative to female hormone imbalance because many of the disruptions in female hormone balance come because of toxic agents, we call them endocrine disruptors, that enter our bodies, sometimes even preconception, and then play out their effect over the lifetime of the individual. Then at the bottom, we have the mental and emotional side of health. So this is who we are as people. Now I want to draw this a little differently to create an even bigger perspective. Tonight we'll be talking about the physiological and toxicological side. Another way of looking at the makeup of a human being. The outer layer is the physical. So this is what we see when we look around the room. We look at each other, we see a certain body size, shape, hair color, features. That's the physical side. We also know pretty well that we all have characteristic patterns of body chemistry. We call that the chemical field. Both the physical field and the chemical field can be readily measured and quantified. We quantify the chemical field with blood tests, saliva tests, urine tests, different kinds of measurements. There's still another aspect to our makeup. We call it the electromagnetic field. So we know that our brains produce brain waves that can be electrically measured. Our hearts produce waves that can be measured with an EKG. Our nerves produce electrical signals that can be measured with the nerve conduction velocity test. So that represents the electromagnetic aspect of our makeup. And notice I've reserved the biggest part for the center, and there's different ways of labeling this. But one popular way of describing it is superquantum information fields. And here's a key concept. The physical is the smallest, and then as you go to the center, the circles get bigger in terms of the impact on our experience and our health. What happens in here really determines what happens in the electromagnetic field, and what happens there determines what happens in the chemistry field. And what happens there determines what happens in the physical field. So the biggest leverage for improving health is shifting the patterns in this area. A little challenging because this is harder to measure and harder to quantify. So what influences this? Thought, feeling, and emotion is an example of a powerful modality that changes what's in here. The nature of our thinking changes electrical patterns. So research done by the HeartMath Institute shows that the attitude of appreciation and gratitude, consciously, deliberately held, changes brainwave activity, changes heart rate patterns. We know that there's a body chemistry that reflects emotion. There's a body chemistry for hope, for fear, for love, and for anger. And those body chemistry states appear instantaneously as we hold a specific emotion. And we know that what happens here, again, thought, feeling, and emotion, has an immediate impact on the physical realm. Perhaps you know someone who has a pain in their neck because there's someone in their life who's a pain in their neck. Or someone who has crippling arthritis of the hands because they're having a hard time getting a handle on a challenging situation in their life. So this is what we call the mind-body connection. And our bodies are tremendously literal in how they manifest what's going on in the realm of thought, feeling, and emotion. We also can call this innate intelligence. Innate intelligence is a term that we in alternative healthcare use for the force. You can call it God or life or innate, that created the body and knows how to heal the body. So within our experience is a source of intelligence that knows what our bodies need to heal. And I see my job as a healthcare provider to be as much as possible in tune with that innate intelligence, to hear what it's saying about what's needed in order to lead to a greater experience of health. So we're going to talk a lot now about the chemical field, but I just want you to understand that there's a bigger picture that really ultimately has to be taken into account anytime we work with a person to balance their body chemistry and their hormones. There's a couple of excellent resources that I want you to know about. The book on your left, What Your Doctor May Not Tell You About Menopause, John Lee, MD. He's one of the earlier writers who described the outcome of the Women's Health Initiative. That was a study of hormone replacement therapy that had to be terminated prematurely because of all the adverse health effects that women were experiencing on synthetic hormone replacement therapy. He introduced the importance of progesterone supplementation to restore hormonal balance. And then on the right, Natural Hormone Balance by Uzi Rice. He's a practicing BGYN doc in Los Angeles. This is an excellent book, especially if you are planning on or want to be using bioidentical hormone replacement therapy. He talks you through a lot of detail about how to learn to self-manage your own use of BID products. This person I included, her name is Zelfa, 87 years old. She lives alone. She spends probably 2 or 3 hours a day in activities specifically designed to maintain and improve her health. Exercises that we've shown her, planning out her meals, what she eats. And she does this because she lives alone, she doesn't have family, she's on a limited income, and she knows that what she does in order to care for herself will determine how long she can live independently, as opposed to living in a care home. She's been an inspiration to me. She went to her PCP and described her problems with balance, dizziness, fatigue, lightheadedness, and she was told, "You're just getting old." We hear that all the time. That's one of the biggest lines of bull that we are being fed through conventional health care. And what that implies is that our bodies are like machines that are going to wear out over time. And in our country, that timeline is very limited. Our life expectancy is terrible compared to even third world countries. There's this limited view that is then promulgated onto the public, and then we all accept the fact that, okay, I'm getting older, I expect symptoms to occur, and there's nothing I can do about it. She didn't buy it. That's why she came here, and that's why she's still living independently, and that's why she describes in the success story that she wrote that she's totally free of chronic inflammation. She's approximately 80% improved in her function over when she first came in. Walking better, stronger, mental clarity, and she's taking the necessary steps to take care of herself. What is a hormone? It's a chemical messenger that transports a signal from one cell to another. So let's say this is a cell in breast tissue, nucleus. Now what I'm drawing here is what we call a receptor, which is like a doorway through which different chemicals pass from the outside of the cell into the cell. What we're describing here is a hormone. So let's say that this is E2 or estradiol, which is the most active of the three female hormones. When this molecule of estradiol locks into this receptor, notice how the shapes are complementary. That's when the hormone changes the activity of the cell. It actually allows the DNA to begin performing its function. And the effect of estrogen on the cell will be to promote growth. That's one of the characteristics of estrogen. We are concerned about synthetic hormones, estrogens, because they will stay in this receptor much longer than natural hormones. They're much more difficult for the body to break down. And so that's why we saw adverse effects from synthetic hormone replacement therapy in the Women's Health Initiative study. So when we talk about hormone replacement, we're not talking about the synthetic form, we're talking about bioidentical, just like your bodies make, that are more easily broken down and don't have that accelerated effect on the receptors or on the cells. But essentially that's what a hormone is. It's a cell messenger. These are the hormones we'll be discussing tonight. Now, the three estrogens as a group, their role is to promote the development from being a girl to the development of a woman. The three female hormones affect body, mind, and emotion. To summarize their role, it's to create femininity, moisture of the skin, the eyes, development of the breast tissue, moisture of the vaginal area, bringing about the developments that allow a woman to then bear children. Good way to characterize progesterone, it's the estrogen shock absorber. Estrogen, unopposed in the body, creates tremendous accelerated tissue responses, which can then lead to problems without the buffering effect of progesterone. Progesterone also is a very strong calming effect in the body. It allows what's called GABA, which is a calming brain chemical, to work more effectively. Testosterone is the primary androgen or male hormone. Women have testosterone, as do men. Men have estrogen along with women, but just not as much. Likewise, women have testosterone, but not as much as men. We'll also talk about thyroid hormone. So again, the holistic view. We can't just look at female hormones because we know that T3, the active thyroid hormone, is essential for the function of the corpus luteum, which produces progesterone following ovulation. If you don't have a well-functioning thyroid, automatically you're going to have an imbalance in female hormones. We'll talk about insulin, which is a hormone that carries sugar from the blood into the cell. That's a very important hormone relative to hormone imbalances because elevated levels of insulin typically occur with elevated levels of cortisol, the stress hormone. And if that's happening, that shuts down different parts of the female hormone pathway and the male hormone pathway. We can't just look at female hormones. We have to look more broadly at what influences them. And then DHEA, this is made by the adrenal glands. It's considered the mother of all hormones. Testosterone and the female hormones are synthesized from DHEA. Okay, let's talk a bit about scope. Chronic illness in our healthcare system. Over 133 million Americans suffer from a chronic illness. 99% of government's health sector budget is used to treat illness after it occurs, even though the vast majority of chronic illnesses are preventable. How backward is that? But that's the nature of the healthcare system we're living in. Our healthcare system and health insurance are pharmaceutically driven, and ultimately there's no money to be made in preventive healthcare. So that's why people looking for preventive healthcare or wellness have to pay at least something out of pocket. If you want quality care for a chronic condition, you have to be willing to participate in the expense. Let's take a look at the normal female menstrual cycle. First, we're going to go through this quickly, kind of high level, then break it down. This is your brain, a side view. There's a part of your brain called the hypothalamus that releases gonadotrophic releasing hormone. That's the hormone signal to the pituitary, anterior especially, that then releases follicle-stimulating hormone and luteinizing hormone. When follicle-stimulating hormone is released, it stimulates what are called follicles, or like hair shafts in the ovary, to start growing and developing. Now, typically, one of those follicles will become dominant, and as that occurs, that follicle starts secreting and releasing estrogen, pictured as this blue line. When there's enough estrogen released by that follicle, it causes a spike of luteinizing hormone, which is also released by the pituitary, and that is what triggers what's called ovulation. And ovulation is the release of the mature egg from the follicle. Now the follicle changes name. It becomes a corpus luteum and begins producing progesterone along with estrogen. The follicle is captured typically in the fallopian tube, the end of the fallopian tube called the fimbria. And if fertilization is going to occur, that's typically where it occurs. And then the fertilized egg travels down the fallopian tube to the uterus, where it implants in the wall of the uterus. And then with the progesterone and estrogen being produced by the corpus luteum, the lining of the uterus becomes thicker so it can accommodate the development of the egg. But if fertilization does not occur, then what happens is the estrogen and progesterone levels drop, showed here, and then the lining of the uterus sloughs, and that's called the menstrual cycle. Going back to that concept of holism, a couple of key points here. Hypothalamus releases gonadotropin-releasing hormone, which initiates that process through the anterior pituitary. But if you're eating foods that you're sensitive to, if you have inflammation in your body from an imbalance of essential fatty acids, if you have infections, chronic stress, high cortisol, all of this activity up here, the hypothalamus activity gets aborted. Pituitary release of these hormones is severely hampered. We can't just look at your levels of female hormones. We have to look at all of the influences that impact that pathway. Another one being cortisol. I just want to talk through this one more time. We're going to use as an example a 25-day cycle. Day 1 is the first day of the bleed. Halfway through the cycle, it'll be around day 12. The cycle is divided in two halves, the follicular or proliferative phase and the luteal or the secretory phase. At the end of the prior cycle, there's a drop-off of progesterone and estrogen, and that drop of estrogen is a signal for your pituitary, anterior pituitary, to release follicle-stimulating hormone. The follicles start to develop, and as they do, one becomes dominant, and it accelerates the release of estrogen to the point where you get a peak in estrogen production. When that occurs, the anterior pituitary then releases luteinizing hormone, which causes the rupture of the follicle. It's called ovulation. And now the follicle becomes a corpus luteum, which produces massive amounts of progesterone, preparing the uterus to receive a fertilized egg. But if fertilization does not occur, then progesterone and estrogen levels drop, and that drop in estrogen is a signal for the pituitary to produce more follicle-stimulating hormone. Typically, the luteal phase, in terms of how many days it occupies, is consistent. If there's variations in a woman's menstrual cycle, it's usually because of changes that occur in the follicular phase. Those changes could include loss of optimal function of the hypothalamus, of the pituitary, secondary to chronic stress, secondary to inflammation, which can be secondary to bad diet, infections, toxicity from chemicals and metals. So again, many factors play into how well this cycle is going to work. If we don't get the estrogen peak, then we don't get the luteinizing hormone release, which causes ovulation. What can affect the estrogen peak? Any of the things we talked about earlier: inflammation, chronic stress, sugar regulation problems, eating foods you're sensitive to, chemical, metal toxicities. So immediately, we begin to see reflected in this pattern everything else in the body. A key point here, though, is that estrogen and progesterone levels fluctuate throughout the month. Very often, symptoms related to PMS or perimenopause or even menopause relate to imbalances in the levels of estrogen and progesterone as the woman progresses through that 25 or 30-day cycle, whatever the cycle is. These are composite symptoms representing different kinds of female hormone imbalances. Female hormone imbalance doesn't just happen by itself. There are underlying stresses that are causing the imbalance. These stresses have to be identified and corrected. Adrenal gland dysfunction, especially spikes in cortisol. Unstable blood sugar, which affects cortisol. Inflammation, whether it's from autoimmune disease, food sensitivities, poor essential fatty acid ratios, hidden infections in the gut, heavy metal toxicity, leaky gut syndrome, dysbiosis, anemias, poor gut function, poor liver function, poor thyroid function, and many more. To help you with your hormone imbalance, we have to look at all of this because all of this plays into hormone imbalances. And how do we go about parsing all that out? It's through proper testing, which could include comprehensive lab work, including thyroid, 24-hour urinary hormone test, food sensitivity testing, stool analysis, adrenal hormone test, and a method of assessment that we use in the office called biosequencing, applied kinesiology. It's a very quick and simple but highly accurate method that's a great complement to the objective lab tests. Let's go to the handout packet and look at the sample lab report. This is the method of lab analysis that I prefer. I used to do primarily saliva along with serum, but I've learned since that for hormone imbalance, saliva is probably the least accurate. The concentration of hormones in saliva is tremendously diluted compared to serum or urine. Also, there's a lot of questions about reliability, how duplicatable hormone testing with saliva is. Stories of doctors sending samples from the same woman to two different labs and getting two different reports entirely. Saliva is secreted by different parts of the mouth, by different glands. They don't all secrete the same concentration of saliva. So there's many, many pitfalls to hormone testing with saliva. I still do some, but preferentially I use this 24-hour urine test. Now I've highlighted the primary hormones, the three estrogens, testosterone, DHEA, progesterone, and the two adrenal hormones, cortisone and cortisol. There's a lot more information on this page than just that. One of the things I like about this report is it shows what's called hormone profiling. So it shows not only the primary hormones, but the metabolites, which they are broken down into. So for example, metabolites of E1 or estrone include 2-hydroxy and 16-hydroxy-estrone. I'm looking at the fourth item down. The ratios between those metabolites can be useful as an indicator of a woman's risk for breast cancer. 4-hydroxy-estrone, that's a metabolite of estrone E1. That is known to be highly toxic to the body. It's a free radical generator. It's highly estrogenic. So if a woman has concerns about breast cancer, uterus cancer, and she's got high levels of 4-hydroxy-estrone, that's a big red warning flag. Now these metabolites themselves are broken down through the liver if the liver is functioning optimally and has the chemical constituents it needs to accomplish that breakdown. Now let's look at testosterone. Again, hormone profiling. Testosterone is converted to a metabolite. It's not on this report because this is for a woman. The metabolite is called DHT, dihydrotestosterone. That's an important marker in men who are concerned about benign prostate hypertrophy because excess levels of DHT will cause the prostate to blow up like a balloon, squeezing the urethra so the man has difficulty urinating. And looking at the cortisone and cortisol, those three items after cortisone and the two after cortisol, those are breakdown products of those two adrenal hormones. The ratios between those, or the totals among those, give a lot of good information about how well a person is metabolizing sugar, if there's tendencies to insulin resistance or diabetes. And so there's a lot of great information that comes from this process of hormone profiling, so that's why I use that profile. Another important consideration is how lab test results are interpreted. I have so many patients come to my office and say that they've had X lab tests done and they were told by their nurse practitioner or medical doctor that all the labs are normal, so there's nothing wrong with you, even though the person has a lot of symptoms, they're not functioning well. That happens so much because much broader ranges are being used to evaluate those lab tests than the more narrow ranges that are used in alternative holistic care. The ranges I use are based on people who are healthy, never been diagnosed with a medical condition, and are not on medication. And so as one example, let's talk about TSH, which is the principal test run to measure thyroid function. The traditional very broad lab range is 0.3 to 5.5. As TSH rises, that's a sign of the thyroid becoming weaker. It has to be at 5.5 for you to be told in a conventional healthcare setting that you've got a thyroid problem, even though you've got hair falling out, cold extremities, fatigue, depression, constipation. If I see that test and it's 4.2, even though you're told your test is normal, I will know that you likely have a poorly functioning thyroid because it's above the more narrow range of 1.8 to 3. So that's one reason why people are often told there's nothing wrong with you, your tests are normal. Another reason is very often in a conventional setting, the number of tests that are run are quite limited and they don't give all the information that's needed. And they're limited because that's what insurance pays for. A lot of people, through their whole life, continue on a downward health spiral. They keep going to the same practitioner, getting the same test done because insurance pays for it, even though it's incomplete information. They're told there's nothing wrong, and so they continue on their downward spiral. To get a different result, it's often necessary to stop doing what you've been doing and do something different. The proper amount of estrogen or progesterone may vary from female to female. In the book by Dr. Uzi Rice that I showed you initially, he goes into this in quite a bit of detail, and this is another illustration of why the concept of normal lab ranges is not applicable across the board. What for you, Jackie, might be a normal level of progesterone and estrogen, for Kelsey might be too high on the estrogen, too low on progesterone, even though both of you might fit within that ideal range. And so in his book, he talks about how he teaches his patients to judge their hormone adequacy or sufficiency based on their symptoms, as well as lab tests. But the symptoms are a key as to how well your body is doing given whatever levels of hormones you have and that have been measured. Everyone's an individual. 50% of female hormone imbalance can be fixed by addressing the adrenal glands. Adrenal glands are responsible for approximately 35% of reproductive hormone production in premenopausal women. So that's your estrogen, progesterone, and testosterone. In postmenopausal women, this contribution increases to about 50%. So a key takeaway here is the woman who has taken care of her adrenals, managing her stress, exercising, good diet, when she hits that perimenopausal, premenopausal, menopausal period of life, she's the one who has the best chance of going through that transition without a lot of symptoms because her adrenals are healthy enough to pick up the hormone production slack. The women who suffer the most are the women whose adrenals have been tanked. They're tired and they're wired, and there's many factors that play into that, but essentially they've been stressed to the max and the adrenals bear the brunt of that. I talked about progesterone as the estrogen buffer. It protects the body from the tissue accelerating effect of estrogen. Progesterone levels, though, are affected more by adrenal fatigue and by the transition in life than estrogen. They're impacted sooner and to a greater extent. So the effect of that is it creates a greater state of estrogen dominance in women, even though those women have low estrogen levels as measured by urine or saliva or serum. The normal ratio of progesterone to estrogen, 25 to 1. It could be even higher than that. So let's say that both estrogen and progesterone have declined with the passage of years, and now the ratio is 12.5 to 1. So even though estrogen is, let's say, minimal, progesterone in comparison can be even lower than it should be in light of that optimal proportion. And so now the woman is actually estrogen dominant in terms of how much progesterone she has. Symptoms of progesterone deficiency, which is related to estrogen dominance: anxiety, insomnia, irregular menses, early or no period, long intervals between periods, first period late in life, history of scanty menstrual flow, difficulty conceiving or carrying to term, depression, premenstrual syndrome. So remember, progesterone is produced by a healthy corpus luteum, and it's critically involved in preparing the uterus for implantation of a fertilized egg. A problem with not enough progesterone leads to these symptoms. Symptoms of progesterone excess, not buffered, in other words, by adequate progesterone. Breast swelling and tenderness, fibrocystic breast, water retention, especially ankles, craving for sweets, uterine fibroids, in other words, overgrowth, cystic ovaries, anxiety, nervousness, heavy irregular menses, low libido, fatigue, weight gain, mood swings, low thyroid symptoms, headache, elevated triglycerides. Dr. Uzi Rice characterizes women who are estrogen dominant by saying that they typically don't get much sympathy from other people for their symptoms related to their estrogen dominance. And the key determinant between estrogen dominance and estrogen lack is the function of the brain. So women with estrogen dominance tend to be sharper up here, but also kind of irritable and snappy. Women with estrogen depletion tend to be more brain foggy, especially entering into the perimenopause, premenopause time of life. The solution to this condition of estrogen dominance, progesterone deficiency, is supplementing with bioidentical progesterone, usually in the luteal phase of the cycle when progesterone levels typically rise. Also, clearing out the excess estrogens from the liver using natural substances. Fiber and DIM stands for diendolyl methane. It helps the liver go through its process of chemical breakdown of different chemicals. Cleaning out the liver and avoiding xenoestrogens. So those are estrogens that we get from the environment that would include the hormones that are fed to chickens and livestock. That would include female hormones, estrogens that we get through cosmetics or even through plastics. Consequently, we have young girls who are 12 or less having menstrual cycles because of this exposure to excess estrogen. Then we have to address the underlying metabolic problems. Okay, the other end of the spectrum, symptoms of estrogen deficiency or erratic estrogen production. Hot flashes, night sweats, mental fogginess, insomnia, heart palpitations, yeast infections, depression, bone loss, dry skin, painful intercourse, lack of lubrication, low libido, vaginal dryness, memory lapses, and incontinence. Major source of progesterone in premenopausal women are the ovaries, corpus luteum, and the placenta, if there's fertilization. Postmenopausally, the adrenals produce a significant percentage. So again, the importance of adrenal health going into premenopause. So this is what progesterone does. Reduces tension in the body by promoting the optimal function of GABA, which is a chemical in the brain that helps calm the nervous system. Promotes a restful sleep because of that action. Acts as a natural antidepressant and mood stabilizer. Reduces PMS symptoms, mood swings, irritability, cramping, and cravings. So we're going to talk about PMS specifically, along with these other conditions. PMS, most often from a lack of progesterone output 1 week prior to the cycle starting. The picture you have here illustrates an unhealthy pattern. If you look at this and compare it to this, it shows that progesterone doesn't drop as quickly in the optimal as it does in this picture. So it's that rapid drop-off of progesterone that gives rise to many of those premenstrual symptoms. Premenstrual migraines can arise from a sudden drop in estrogen. Progesterone supplementally can help. Also, DHEA used in what's called burst therapy. That's where you take 10 to 15 milligrams a day for 2 to 3 days during that period when estrogen drops rapidly. Because DHEA can be converted into estrogen, and it has estrogenic effects. It activates those doorways, the receptors on the cells for estrogen. So this is abnormal. What you should have is an earlier peak rather than a late peak and a rapid drop-off. Polycystic ovary syndrome. So this is when the ovaries become cystic. This is actually the most common cause of infertility in our country. It's secondary to problems with sugar regulation, what we call insulin resistance. So when there's insulin resistance, it creates inflammation and changes in the surface architecture of the ovaries. It can also lead to loss of ovulation. So here are some of the characteristics of PCOS. elevated triglycerides, estrogen, testosterone, and also possibly DHEA excess, increased risk of diabetes, hypertension, cardiovascular disease. Characteristic symptoms: weight gain, blood sugar problems, infertility, often endometriosis, acne, mood swings, fatigue, and also hair loss, one of the common causes of hair loss. Polycystic ovary syndrome that we just talked about is the #1 cause of infertility, but also we have to look at adrenal gland function, look at the GI system, rule out foods that a person is sensitive to, also infections, and look at liver toxicity. And we have to also look at the higher aspect of that endocrine chain, hypothalamus function, and anterior pituitary function. Loss of libido can be related to low progesterone, adrenal exhaustion, and obviously relationship issues, but also low testosterone. The birth control pill is synthetic estrogen and progestin. What it does is it raises the blood levels of estrogen, and so it shuts off this whole cycle. Because if estrogen is already high, there's no reason for the pituitary to release follicle-stimulating hormone. Birth control pill is the most effective method of birth control, but it has quite a few downsides, and ultimately, it's not really known the long-term effects in the female body of the birth control pill. Because it's synthetic estrogen and progesterone, they stay in the body a lot longer. Their effect on cell receptors and cell membrane is a lot stronger. And Dr. John Lee, he's the other author that I showed you the book of, he goes into some detail about the downside of birth control, and what's been found is increased risk of breast cancer, 6 times greater risk of thrombosis or blood clots, 4 times greater risk of stroke, 4 times greater risk of heart attack, increased risk of ovarian cancer, thyroid cancer, and liver cancer. If you've been on the birth control pill and are off, or if you're on now, there are certain steps that can be taken. Progesterone augmentation in the luteal phase can help restore the natural cycle. Very important to target the liver and give the liver the support it needs in order to break down those excess synthetic estrogens, because that's where the action occurs. Perimenopause management. Progesterone gradually declines by age 30. Estrogen rapidly declines in perimenopause, so later in life. In order to understand the relative balances between those two, 24-hour urine profile is very beneficial. But essentially what happens is progesterone drops off sooner and more dramatically than estrogen. So even though estrogen levels start to decline in perimenopause, in comparison to the amount of progesterone, that woman is 90% of the time or more estrogen dominant, and so runs the risk of those symptoms associated with excess estrogen. Let's talk about menopause management. Ovaries aren't producing as much estrogen, so the adrenal gland then has to take over, so the health of the adrenals is crucial. We measure hormone levels through the urine and provide supplementation to the menopausal woman to maintain as healthy, optimal levels of the sex hormones as possible. And we also have to look at the underlying issues that impact hormone levels. Okay, I want to talk a bit more about synthetic hormones. All studies showing ill effects of hormone replacement therapy for females were done using synthetic hormones not bioidentical. For example, Premarin or Provera. So these are toxic and foreign to the body. Premarin, by the way, is the urine of pregnant mares or female horses, while part of what is there is identical to what the human female body makes. About 50% of what is in Premarin is natural to the pregnant horse, but it's foreign to the female human body. Another indication why there's been such a higher risk associated with synthetic estrogen. So you must use bioidentical, not synthetic. Even with that understanding, a lot of women these days are really reluctant to take bioidentical female hormones because they associate them with the same risks associated with synthetic hormones. So I want to allay that risk by showing you this information. This is from Journal of Cancer, 2005. So this is portraying the different risks associated with the different types of hormone replacement therapy. So the first line shows hormone replacement therapy users compared to non-users. Hormone replacement therapy users in that line is lumping together all the women taking any kind of hormone replacement therapy, whether it's natural, bioidentical, or synthetic. And those women, compared to those not taking any hormone replacement therapy, had a 20% increased risk. That's what the 1.2 relative risk means for breast cancer. Women taking estrogens alone, as opposed to estrogen with progestin, had a 10% increased risk. So again, that's synthetic estrogen. Now the next line refers to bioidentical estrogen and progesterone. There's a 10% decreased risk in the women taking bioidentical progesterone and estrogen compared to the women not taking any hormone replacement therapy at all. Now here's the kicker. Synthetic estrogen and synthetic progestin, 40% increased risk for breast cancer. So you can see that women taking bioidentical hormone replacement therapy had a 10% lower risk for breast cancer than women not taking any at all. And I mention that because there's so much value and benefit that can be derived from bioidentical hormones supplement if one can get over that fear factor. Progesterone creams can create problems. They can be difficult to determine dosages. The progesterone can build up in the adipose tissue, not ultimately get into the serum, so it can then access target tissue. It stays in the fat tissue, and that can create its own set of symptoms. Progesterone applied topically can then be given unintentionally to spouse or even children. So when we recommend progesterone, we use it orally, and we use it in an oil base so that it goes into the lymphatics, so it's not broken down prematurely in the liver. It goes into the lymphatics, and from there it goes into the target tissues. We always want to watch out for xenoestrogens. These are the synthetic estrogens from the environment, whether it's food or personal care products or plastics. I see a lot of women these days whose 24-hour urine test shows decreased testosterone levels, and there's a lot of research correlating that with exposure to what are called phthalates, which is what's in plastic. So environmental toxicity is a huge, huge problem in this area of hormone imbalance. So here's some options to increase estrogens. Sublingual DHEA will increase estrogenic activity because it's ultimately converted to estrogen, but it also increases the activity of estrogen receptor sites on cells. We have to control insulin resistance. That relates to how well we manage our sugar balance. Now, one popular bioidentical prescription product is called Trieste, and that's all three estrogens, estradiol, estrone, and estriol. Biest is just E3 estriol and E2 estrogen. So those are very commonly prescribed. Those are prescription products. One downside to that is potentially cost. They can be up to $300 a month. So what we use in our office is Phyto-B. It's plant-based bioidentical progesterone and estrogen. And just like the Trieste and Biest, it's exactly identical to the hormones that your body makes. And the cost of those is quite a bit less than prescription, around $30 a month. Also, there's different herbs which have pretty good track records. They don't contain hormones, but they give the body the raw materials that it then uses to make hormones. Options to increase progesterone. What we use is a yam-derived bioidentical progesterone called Progon-B. It's taken orally. Compared to the prescription progesterone, the cost for this might be $20 to $40 a month. I want this to be the last image that you have in your mind. Hormone balance and health is really a byproduct of all of the upstream patterns working well. Rather than take a symptom treating approach and just give you progesterone or estrogen because you have those symptoms, my preference is to look upstream and see where breakdowns might have occurred. If those are still unaddressed, likely taking a bioidentical hormone product isn't going to make a big difference. So we have to really get back to the core causative issues shown on that slide. As much as possible, we like to help the body do what it does in a state of health. If it can no longer do that, then we provide replacement therapy, and that's where bioidentical hormones would be used. The younger the person, the greater the chance that their body can be brought to a state of health where they don't need a finished hormone product in order to have optimal function. The general rule of thumb is anytime you give the body something it makes, the system that makes that something doesn't have to work. But at a certain point, that becomes the sole option if we want to improve the quality of life and function. So our offer we describe as a consultation, case review, neurometabolic evaluation. It's 2 visits. On visit number 1, we talk about the health concern. As necessary and appropriate, we do a neuro brain evaluation if there appears to be a strong neurological aspect. Evaluate organs through questionnaires and other methods. Whatever labs you have from the past year, you would bring those so I could assess those. And if you are married or have a significant other, you could bring that person as well. On visit number 2, I tell you, based on my review of all of this information, if you're a good fit for our office. Not everybody is. And if you are, then I tell you if any further testing is needed, and then lay out an action plan, what we're going to do, how often we need to see you, what the outcome is expected to be, and of course, what the cost is. Normally these 2 visits are $250, but for those that have attended this talk, we discount it greatly to $39. If you schedule and pay for that visit tonight, thank you very much for coming, and hope to see you.
Thank you.
Okay.